Thank you, Mr. Chairman. And I think these are exactly the types of forums that we all need to be engaged in from start to finish, because
Can you speak up, Senator McCarthy?
there has been there's been considerable discussion here about many issues. Certainly, a lot about vaccines. I care deeply about making sure that our vaccines are safe, the efficacy of them, the availability of them, how we disseminate them is particularly important in a very, very rural state like mine. You have experience there. You understand that. I am particularly attracted by the focus on chronic diseases. We know that if we can do a better job with chronic diseases, maybe some of the other things that we are susceptible to in the infectious diseases area, we're able to perhaps pull back a little bit on that. But our reality is, in order to make this country healthy again, it is a focus on everything. It is the prevention. It is the necessity of coming up with these life-saving vaccines that are going to be so critically important. It is personal care. It is food. It is exercise. It is all of the above. And we got to figure it out together. We do need to shake some things up, but we also need to give a level of confidence. And this is what I'm hearing from so many of my colleagues who have raised the issue of vaccines. We have made some considerable gains in my state of Alaska with vaccinating the many people in very rural areas where one disease outbreak can wipe out an entire village. We saw this in 1918 with the Spanish flu, and that's why everyone was rattled to the core. Villages were shut down entirely during COVID because of the fear of transmission. And so they're looking for these life-saving ways and means. And so when there is a lack of confidence, when there is a doubt, it's like, well, what do I do? And so we're pulling back then on, again, these areas where we can work to prevent some of these deadly diseases that we thought we had wiped out years ago. We have dramatically reduced diseases in my state like Hep A and B and meningitis. We're just now getting through a tough bout of whooping cough that came around to the state. Now there's a scare in the peninsula in Alaska about a measles outbreak. So we can't be going backwards with our vaccinations that will allow for this level of prevention and protection. So I'm asking you, you are clearly an influencer. You are clearly an influencer. You would not be in this position today. But you can see how your podium, your platform, your voice can influence so many. So I am asking you on the issue of vaccines specifically to please convey with a level of authority and science, but also with a level of conviction and free of conflict and free of political bias, that these are measures that we should be proud of as a country. Proud of as a country. Look to what President Trump was able to do with the COVID vaccine. It was extraordinary, and it did save lives. I need time for a question, so I'm asking you to focus on how you can use your position to provide for greater levels of confidence to the public when it comes to these life-saving areas. So I'm going to pivot to a question that you can answer. This relates—
I can answer that one, too.
I know, but I have 43 seconds, and no one has talked about our Native populations. When you look at our health statistics, whether it's Alaska Natives or whether it is American Indians, our health statistics in this country, you know very well, because we talked about them, are not where they need to be. And it's in all categories. It's infectious disease, it's tuberculosis, it's Hep C, it's mental health, it's depression, it's substance use, it's sexually transmitted diseases, it's hypertension, stroke. It is so deep, and it is so challenging, and it is so hard. You have received support from Native American tribes. You have been in these areas. You have been quoted, and I'd like for your comment on this, as quoted saying, as far as budgeting for Indian country, you said you would immediately triple the budget to support tribes. Can you expand on this pledge and the commitment? Because this is an area where we have truly left our Native people behind when it comes to their health and their health outcomes.
Yeah, thank you, Senator. And, you know, this is an issue, as you and I talked about, that is very important. It's always been a priority for me. I spent 20% of my career working on Native issues. I was one of the founding editors of Indian Country Today, which is the biggest Indian newspaper. My father and uncle, Ted Kennedy, my father, were deeply, deeply critical of the functioning of the Indian Health Service back in 1968 to 1980, and nothing's changed. Nothing's gotten better. I'm going to bring in a Native at the Assistant Secretary level. I'd like to get him actually designated as a Assistant Secretary for the first time in American history. Make sure that all of the decisions that we make in our agency are conscious of their impacts on the First Nations. I've spent a lot of time in your state. It's my favorite place to go. I've been up with the Gwich'in, representing the Gwich'in people up in Arctic Village, and been all over the state in the remote areas. I understand in Alaska the unique needs of Alaska because of remote healthcare, because some of these areas are not even accessible except for airplane. That they don't have ambulance services, that the federal government needs to pay attention to financing transportation, the unusual ways that are required there, and that we really need to focus on telemedicine and AI. Make sure that even in remote places in Alaska, that Native people can get high-quality health care, and we can do that today. And I look forward to working with you on those issues and others.
Thank you, Mr. Chairman.
Senator Murkowski sets the record for going over.